We realized that patients didn't know when to come to the emergency department, when to select an urgent care, when to see their doctor. They didn't know a lot of the information that we knew as clinicians about the potential causes of their symptoms. So we thought if you could put all that information in some type of technology that you have with you at all times, it could really help patients before they get to the hospital, when they're in the hospital, and we're trying to have a conversation with them about their symptoms, what they're experiencing, what we think is causing it. And then once they leave the hospital, to try to navigate their post-acute care.
And it's a huge issue. If you think about close to 40% of emergency department visits could go to a more efficient level of care, meaning an urgent care, retail clinic, or physician, and you multiply that times 130 million yearly ER visits.
It's billions of dollars.
It's billions and billions of dollars that are basically wasted, because there's good data that shows that getting seen for an ankle sprain in urgent care is no different than being seen in an emergency department. So that was a big problem. We also saw the other problem. The other side of the ledger was people coming from urgent cares because they had a high deductible health plan. They didn't want the extra expense of their emergency department visit, so they'd self-direct themselves to an urgent care with really serious problems, bowel obstructions, heart attacks, and strokes, with an increased cost because they had an ambulance ride, urgent care visit, as well as a delay in care.
So in 2008, we started iTriage as a company to build mobile health technology for consumers, helping them to navigate the medical information out there, symptoms, conditions, procedures, clinics, emergency departments, physician offices, put that into a mobile format for them to be able to have that information when they made better decisions. So right at their fingertips, always available, able to be location aware, to connect to clinical information systems at hospitals. And we started talking to providers and payers about working together with us to make that system very, very simple, convenient, and easy to use for consumers.
We call them the 3 Ps, the patients, providers, and payers. It had to benefit all 3 of them. So the patient gets to find the most cost-efficient care that's the easiest to access, doesn't have that ER wait time that Peter was talking about. The provider gets to take care of someone that's they're trained to take care of. And the payer, and that could be anybody, that could be the patient if they're paying out of pocket, that could be an employer if it's one of their employees, or it could be a health plan, gets to pay for that service at the most efficient level. So having that sort of virtuous cycle where it benefits all 3 of those Ps was super important. I remember that day, Peter actually invited me up to his house. He lives up in the mountains, and I live here in Denver, on my birthday, September 5th, 2008, to tell me about the idea of iTriage. It was originally his idea. And after 45 minutes, literally on the back of a napkin, it's a colloquial saying, but it really was true. We drove down to a bank in a market. It was one of those, like a Chase Bank in a market, and started a company. Wrote some checks, started a company, and 5 months later, we had the first application in the market.
We started by taking all the information we knew and creating medical content that was very focused, that worked really well in a mobile environment, and was action-oriented, something that we saw patients struggle with every day. And we used our medical advisory board to check the content we created and make sure that it was appropriate based on what specialty they had expertise in. We then assembled all this content into a very simple, focused mobile application that we initially had some contractors develop for us. And we went to friends and family and said, hey, we have a business idea. Here's our prototype. Here's what we think we can do as a business. Are you interested? And we raised money in about 10 days in January of 2009, which was a crazy time to raise money. And by March 16th, I believe, we launched a product in 2009, and that was really the birth of iTriage.